Okay, well, we are going to get going this morning, and out of respect for time, we have a guest speaker this morning, and so we're going ahead and get started. Hey,
Maggie.
Okay, all right. Well, okay, so I'm going to get started with the meditation, and then if we've got some new folks, we can go on ahead and introduce and go from there. So we do begin with the word of meditation for those of you who may be new. I am hoping that this is not offensive to you. If it is, that's fine too. Just go ahead and mute for about 1 minute and 30 seconds. And because we are a faith-based agency, we are owned by the poor handmaids of Jesus Christ. And so we do begin our meetings with a word of meditation or prayer. And this morning, I have felt that it would be great for us to meditate on this: do not worry. And this is actually a passage from the book of Matthew. Do not worry about your life. Don't worry about what you will eat or what you will drink. Don't worry about how you clothe your body. Living is about more than merely eating, and the body is about more than dressing up. Look at the birds in the sky. They do not store food for winter. They don't plant gardens. They do not sow or reap, and yet they are always fed because your heavenly Father feeds them. And you are even more precious to him than a beautiful bird. If he looks after them, of course, he will look after you. Worrying does not do any good. Who here can claim to add even an hour to his or her life by worrying? Nor should you worry about clothes. Consider the lilies of the field and how they grow. They do not work or weave or sew, and yet their garments are stunning. Even King Solomon, dressed in his most regal garb, was not as lovely as these. And think about grassy fields. The grasses are here now, but they will be dead by winter. And yet God adorns them so radiantly. How much more will he clothe you, you of little faith, you who have no trust? So do not consume yourselves with questions. What will we eat? What will we drink? What will we wear? Outsiders make themselves frantic over such questions. They don't realize that your heavenly Father knows exactly what you need. Seek first the kingdom of God and his righteousness, and then all these things will be given to you too. So do not worry about tomorrow. Let tomorrow worry about itself. Living faithfully is a large enough task for today. All right. Yeah. So I think that is an awesome meditation and message for all of us. Who hasn't been worried about things? I know I have. I've been worried about getting this technology right here in this room here this morning. So let us not worry about things that are going to be taken care of. Let's just live our lives to the best of our ability and rest and depend on God, who is able to do so much more than we can. So, ladies and gentlemen, I want to say gentlemen, but I don't know if there's a gentleman on the screen right now.
Jared.
Without further,
Jared is here.
Oh, is Jared there?
Jared.
Oh, there's, okay, yes, Jared. Okay, there you go, Jared. Hey. But I see there are a couple of new faces. And so we would like for you to just introduce yourself and say which organization you are from, and then we'll go on ahead and get started. So if this is your first time or you haven't been back in a long time, if you could just introduce yourself, that would be
awesome. Well, I'll start. My name's Sarah Lewis, and I'm here with Autumn. Autumn's in Fort Wayne. I'm in Wayne County, but we're health navigators at Aspen, so we provide free assistance for Medicaid and marketplace insurance. So Autumn's just getting out in the community to meet more people, try to make some connections. So I thought I would join the call with her today. But...
Right. And now, is Lee no longer with Aspen? Should we not be looking for Lee?
No, he's gone. So I'm sorry. He's been gone for a few months. So Aspen is, Autumn is the new Lee. Yeah.
Okay, there you go. I thought I was saying Leo at first. Okay, so it's Lee. It was Lee.
Yeah.
All right. So Autumn, Did you already introduce yourself, Autumn?
No, but I'm Autumn. So yeah, I just started with Aspen a few weeks ago, and I'll be over the Allen County area. So, like Sarah said, I'm just trying to make some new connections, and meet some new faces.
Okay, wonderful. Thank you. Welcome, Autumn.
Welcome.
Are there any other new or haven't been here in a long time folks? I can't see the full, I have it on speaker view, so I can't really see everybody. Okay, so I'm not gonna, I don't see anybody that I just need to call out. Hi, Miss Kane, Dr. Kane. How are you? Okay, she's.
Hello there. I'm doing
Hello.
well.
Okay. Coming to us all the way from, what is that, Muncie?
Muncie, Indiana. Yes.
There you go. Okay, good.
Hello, Dr. Kane.
Hi, how are you, Peggy?
I'm good.
So what we're going to do is we're going to go on ahead and get started. We have a wonderful presentation today. I was trying to figure out what to present about or have someone present about. And Felicia had a great idea. Hey, what about those community cards that have been talked about in the news, but that we really don't know that much about, because they are touted to really serve people in the people that we serve, underserved groups. And so we invited Nicole here from Catholic Charities, since this is a project of Catholic Charities. Hi, Nicole. And so she's going to talk about community ID cards and how they can help folks, and what they do and all of that. So Nicole, I'm actually going to let you introduce yourself today. And you have a presentation. Now, I did get it. Did you want me to control the presentation, or are you going to control the presentation?
I can control it. I think I will just need you to grant me access to share my screen.
You should be able to.
Okay, let me try real quick. Sorry, everyone. Let me pop this up.
Has everybody heard about the community cards in the news? I see some heads nodding. I see all of that. Hey, Sylvia. Sylvia Wade is in the house today. Haven't seen you in a while. She's waving, but we see your side profile, not your front profile. She was waving.
Yes, thank you guys. I'm glad to be here. I've been missing all of you, and I haven't heard anything about the community card. So good education. So thank you.
Okay, awesome.
Okay, can everyone see the PowerPoint?
Yes.
Okay, great. Well, I will start off by introducing myself. So my name is Nicole Kurut. I'm the Mission Advancement Manager here at Catholic Charities. So I oftentimes will go out into the community and share what our mission is, what our programs are, and just answer questions. So Luz Ostrogny, who is our immigration supervisor, she was supposed to be with us today. Unfortunately, she had a family emergency pop up. So she sends her regrets. This is kind of her project, her baby. So she loves getting out into the community and talking more about it. So I'm going to do my best to answer all the questions you have. And if I cannot answer it, I promise to write it down. And Luz will be able to follow up with you to answer those questions. But so today I'm going to talk a little bit, just briefly, about Catholic Charities, so you know what all services that we have. And then I'm going to jump into the particulars about the ID card and then follow up with questions. So go ahead and get started. So for those of you that don't know anything about Catholic Charities, we've been around since 1922. So we'll be celebrating our 100th anniversary this April. Really, we have 20 different programs. As you guys, I'm sure you guys know, poverty is not a one size fits all problem. So we have to tackle it through a lot of different avenues. A lot of people come to us whenever they're in the dependency and crisis area. And as they work towards vulnerable and stable, they get trapped in this gap that's right here, where they don't know what resources that they can use to really get to that stable and eventually that self-sufficiency marker. So that's really where we shine, is this gap between vulnerable and stable. And they can come to us and receive services. I'm not going to go through all of our programs today, but I just did want to highlight some of them so you guys know what resources we can help out with. So the first is Alleviating Poverty. We have a great financial assistance program here. So if people need help paying back due rent, mortgage, or utilities, we are able to help them with those bills. They can apply it on our website. Healing Mind, Body, and Soul are programs that are focused more on counseling and health translation services. We also have a program for human trafficking survivors and helping them set up their life. Building Stronger Futures is focused more on education, mentoring, and as well as our immigration and refugee services. I think everyone's pretty well acquainted with our services there. And then finally, Developing Financial Security. Getting out of poverty really depends on how well we know our finances and if we have jobs. So we have financial literacy components to all of our programs, and we have a couple of programs that help people find work. So really all of these programs are going to take years for our clients to get through, because we're focused on those long-term solutions and long-term case management. So that's a little bit about Catholic Charities. If you guys have any questions at the end about our programs, I'm happy to answer them. But for now, we're going to go ahead and dive into our City ID program. So I know a lot of people since the announcement have been asking, why? Why do we need another form of identification? So we know that without a form of photo identification, people can't access things as simple as library cards and things as difficult as receiving medical services, reporting a crime, and accessing city services, just to name a few. So a lot of people in a lot of different populations have issues getting IDs. So the homeless populations, undocumented, some fostered youth might have issues. And then I don't know if you guys have ran into the Real ID, which is the new state or driver's license identification cards. There's a lot of barriers, even for you and me and people that might not fall into these first categories, but the Real IDs are very difficult because you have to have your birth certificate, you have to have your marriage license, and there's a lot of barriers. And if you're not set up with a printer at home or be able to drive down to the city county building to access some of these documents, you might have a really hard time getting identification. But everyone should be entitled to basic identification. And that's because when we all have IDs, it's safer for our community. There's economic benefits because people can then open bank accounts and access jobs more readily. But I really think we should hone in on the safety feature. Everyone should be able to identify themselves, because they might, get hit by a bus, and if the police show up, they need to have some type of identification at the very least. And we've worked really close, not only with the mayor's office, but also with law enforcement, because they were running into this issue. There was victims of crimes and no way to prove their own identification. So it's really been a collaborative effort in getting these IDs created, because a lot of city services were running into the same issues that we see. So here's a look at our ID card. It's pretty simple. Mayor Tom Henry signed this in on October 14th. We will be serving as the fiscal agent and the issuer of the card. So basically the mayor gave his blessing for us to pass these out. In order to get them, you have to call our office. We're not accepting walk-ins. Since October 14th, we've had over 800 calls just for the City ID program. And we've already issued probably 150 or more ID cards. So if you work in city services, you'll probably start to see these cards. In order to receive them, you have to be a Fort Wayne resident. They do not work outside of Fort Wayne city limits. So you have to prove that you're a Fort Wayne resident by bringing in utility bills, letters from a social service agency. So especially if you're at a shelter, you can bring in those documents, house of worship, tax assessments, school records, things like that. And then you need to bring 2 forms of identification. So that can be a US or foreign passport or driver's license. You can bring in national identification cards, consular cards, or school IDs. And really the best way to think about these cards is as a school ID. Think about those benefits. You know, you have people walking around your campus, they need to have some type of identification saying that they belong on school campus. And then they're only allowed to really use those identification cards to access services there at the school. So it's very comparable to a college ID card. It's just within Fort Wayne city limits that people will be able to use it instead of a campus. And then the cost is $25 for those ages 18 to 64. And those who fall outside those age ranges, it costs $20. Minors are able to also receive the card as well. I think if there's anything else I need to talk about on this one. Limits of the ID, it cannot be used for voting. I know we've been getting a lot of those questions. It says right on the ID, you cannot use it for voting or as a substitute as a driver's license. You also will not be able to use it to board a plane or really anywhere outside of Fort Wayne city limits. It might not be recognized. It is not a state government issued ID. That's important to note. It's just issued by Catholic Charities. And then we've had a lot of businesses calling to see if they can accept the card for like alcohol or cigarettes or something along those lines. And that's really up to the discretion of the business. We send them the proof that we receive, as in, these are the identifications that they have to bring in order to get these. If that meets your minimum qualifications, then it's up to you whether you want to accept the card. But it cannot, once again, be used if you need a state ID instead. So I'm trying to think, there's something that just went into my head. Well, I'm sure you guys will have questions. So with that, what questions do you guys have that I can answer for you? Oh, you're on mute, Sharon.
Okay, sorry. So I think you can unshare your screen.
Oh, yes.
And but my first question, I think there are some questions that are coming into the chat. So if you have questions and you don't want to just say it out loud, just go on ahead and put it in the chat. But my first question is, first of all, thank you so much for that presentation. That gives us some much needed information. My first question is, you said that in order to get the city card, you need certain types of ID, like you could use a passport or a driver's license and those types of things. But if you have a passport or a driver's license, why would you need a city card, or community card?
So it's more for, well, first off, anyone can have the city ID. So anyone that's a Fort Wayne resident can have it. And really, we want to encourage the general public to have these IDs. South Bend, Elkhart, Plymouth, and Goshen all have this very similar program, and they become really pride points for the whole population to get these identification cards to say, I'm a proud citizen of this city. And really, we would love to see the same type of excitement in Fort Wayne. We're working with some businesses to see if we can use them as like discount cards, show your Fort Wayne ID and you would get a discount for this or that. We're still talking to businesses about something along those lines, but we would love to see the general public to get these, because it's really not just for one population. But for those who might be undocumented, they might have their foreign passport. So we would accept their foreign passport, but they wouldn't be able to use that passport to get a state ID or a driver's license. They're not allowed because they're undocumented. They would not be, sorry. They are not able to receive identification at the state level. So they would be able to bring in their foreign paperwork, and we will recognize that as identification. So yes, undocumented immigrants would be able to use these cards.
But you do need to have some type of a photo ID to get this card?
Yes, to be able to prove who you are. But we, if you have a school identification, if you have, like I said, a driver's license or some other type of photo identification from a different country, we'll accept a lot of different things. But yes.
So if you're undocumented and you don't have a photo ID already, then you can't get this card either.
Correct. We have to have some way to prove that you are you, but they might be able to, and this is where Luz would be able to explain more because she runs into a lot of these issues, but I'm sure working with Luz, who's knows everything there is in the immigration world, she would be able to help them maybe go through the proper channels to access some type of photo identification from their country of origin.
Wow, okay.
Yes.
Okay, so let's look at some questions that are in the chat.
Yeah, we have quite a few.
Okay, Peggy, you want to read them?
Yes. Are there any programs available to persons who may not have the $25?
At this time, we do not have something along those lines, but we are starting to receive more questions about that. So it's something that we're looking into.
Okay. The next question is this, it was a statement that seems to defeat the needs for the undocumented to get this. And they're the ones who really need it when you say that they didn't have an ID, any kind of photo. So Paula was just making a statement that it seems to defeat the purpose.
Yeah, I would say the vast majority of the people we're seeing are the undocumented population. So far, we haven't ran into that issue yet. Like I said, we've had over 800 calls and by over 150 people that have already gotten the ID. So we haven't ran into that issue, but we also need to make sure that they're that when people are trying to get these ID cards, that they are who they say they are. And that's just a matter of public safety. And also when people come to us to get these forms of identification, we're not going to keep those records. The ID card's good for 2 years, but we don't keep any type of list of who's getting the cards. And once again, that's, so we remain credible as an agency that, if ICE shows up one day, we don't have a list or anything along those lines. So we want to make sure that people who get these cards understand that this is a safe place to come and get a form of identification. Because I know we've had some people ask questions about that as well.
Okay, Autumn asks, what about homeless individuals who may not have an address to get bills?
Yeah, so you could, if you're at the rescue mission or another shelter, we would accept a letter from there, or if they're working with another social service agency, we would accept a letter from their agency as well.
Okay. And I see that Maggie has a question here. Does information such as organ donor information, emergency contact also link to this card, or can that only be on the state ID?
I believe that's just for state ID. We do not have that feature at this time. That's a great idea, Maggie.
Okay. Anything else? Any more questions, comments about the community ID card?
I do have one question. How old can the documents that they're bringing be?
That's a really good question. I think as long as they're still valid, that they would use them. But I'm sure that they have to be valid forms, you know, so.
So if someone was an adult and they brought in like a passport from their country of origin, but that passport has expired, then that wouldn't be allowed?
It's a really good question.
We have to pass some of these questions on to Luz,
Yes.
huh?
You guys ask really good questions. I'm so sorry she is not here to better answer these things. So I am writing everything down, and I will send these questions or the answers rather, to Sharon, and hopefully Sharon, you can disperse everything
Of
to
course.
everyone here today.
And something else interesting that you said. I mean, I think this whole issue is very interesting, and how we're going about these cards. Something else you said you're not keeping a record of who has the card. So once someone gets the card, could they conceivably like just get a card to somebody else who didn't have that information? And
it will have their photo on it and their address and all of their, you know, information, their height, their weight, their eye color. So I don't know how someone else would be able to use their card, other than, you know, if they look very similar, I guess. I'm not sure, but it will have their own photo on it, just like a driver. It looks just like a driver's license, other than it's not a driver's license, but it has all most of the same information on it. So, I mean,
okay,
you know, that issue happens with a state identification card as well.
yeah.
But no, they wouldn't necessarily be able to do that, because all that information is going to be linked to that individual.
The information on the card, but there's no other place where the data is stored for trust reasons.
Correct.
So Nicole, how long did you all work on this with the city? I know you've been working on it a while. I don't know if LSN was involved. I know there are a number of different agencies that serve immigrants and refugees who are very excited about this card. So how long has this been in the works?
Yeah, so last year, I think it was about a year ago, actually, Luz and a lot of different agencies that serve the immigrant populations got together, and we're just talking about a lot of the similar issues that they all run into. And that's that their clients are coming to them and don't have any type of identification, and that causes problems for the clients as well outside of the scope of social service. So they're trying to figure out what we could do, and someone brought to the table, well, South Bend has this very similar program, and it's worked out really well. I believe South Bend started in 2016. So, you know, we can kind of look at that and see some of the barriers and successes that they had as a community. And overwhelmingly, it's been very, very successful. So Mayor Henry actually asked Luz to start this program. He believed in Catholic Charities and our great relationship that we have with these communities to be the trusted resource. So we've been working with the city for some time on this project, and we're very excited to announce our partnership with the city in this way.
Wonderful. So, okay, so you said about 800 people have called since basically the past 2 weeks.
Yeah.
So what is the wait time? How long does it take to get a card? Are these people making appointments, or what's going on with that?
Yeah, so they're making appointments. Whenever people call in, they'll get transferred to basically a voicemail line. And if they're Spanish speaking, we have interpreters to take those calls as well. And then we will call them back and schedule an appointment. I think right now we're booked for several weeks out. So we're asking people to be patient as much as possible. You know, anytime that there's a new program like this, that's highly sought after, that there is going to be a little bit of a wait, but we're working long hours. We have multiple staff that are dedicating time to try to stop this bottleneck. I think that Luz is even doing some weekend hours So we're really trying hard to get these out to people, but we're going to need everyone to be a little patient. And
150 have already been issued.
Yeah.
Okay.
Yep.
Okay. So I'm sure, as you all know, that during the pandemic, this issue of, having ID, that really came up quite a bit. Even though some of the medical professionals and clinics said, oh, well, you will be able to get this, everyone can get it. There were still problems and issues with people who did not have photo identification going to places and still being asked for photo identification, or some type of identification. And so that's just one example of how this issue of not having a photo ID can really kind of hurt us as a community. And so we definitely appreciate this effort. Are there any more questions? Any more comments? Okay, so what we're going to do as social service agencies and the various areas where we all work, we're going to now be able to tell people more about the cards, and especially after you send me those answers to the questions, and we can get that out to everyone and let them know even more of what's going on. But now that we understand a little bit more about these community cards and how they can be used and how people need to obtain them, we can be better equipped to serve. So thank you so much, Nicole.
Yeah.
Definitely appreciate your time and coming in and joining us. We're getting air claps all over the Zoom. Yay. And so we appreciate you. Okay.
Yes, thank you guys. I should have mentioned too that we're actually talking to the library right now about possibly setting up some satellite spots as well, that might be on weekends. So there's more to come on that. We just had a meeting like 2 days ago about it. So we're hoping that we would be able to maybe mobilize access points as well and bring it into different communities. So more to come on that. Sharon will be in touch as everything grows. And if you have any more questions or need to look up information, we do have a page on our website for the community identification card. And we also have it in Spanish in case you need to send that as a resource to clients. So
are there any Burmese interpreters, or is there available for others?
If they call and leave a message in Burmese, we can definitely have one of our staff members translate for that. We're mostly seeing Spanish messages come in. Refugees I don't think that they would technically need this card because they get state identification cards or driver's license. So we see mostly this being useful for those who are undocumented. Though, like I said, technically everyone can get these cards. I know most of the staff members at Catholic Charities will be getting these cards just to show our support. So we would love to see each and every one of you make an appointment.
And let us know about those discounts too. I mean, I hadn't even thought about getting a card, but maybe if I can get a free meal, I don't know, I might be able persuaded to show my pride.
Perfect.
In my Fort Wayne residency.
Yes.
Okay, thank you, Nicole.
Thank
we
you
appreciate
so much.
it.
Have a good rest of your day,
Okay.
everyone.
Okay, thank you. Okay, Kidani is with me. See, thank you for not leaving me out there by myself on that, Kidani. Okay, so you know what? It is 10:35. It is time to share and network. All that is going. Oh, wait a minute, Felicia. We have some announcements from Health Visions. First.
Yes. So I am in charge of doing the event listings, and so Sharon and I have kind of talked about just the best way to move forward with them. So we've decided that on the first week of the month and the third week of the month is when we will be sending out your different events. So please email them to me. I can put my email in the chat, but if you could send them to make sure I have them before the first week of the month and before the third week of the month. So preferably 2 weeks in advance before your event actually happens so that I can compile everything and make it easy for everyone to see your event and to be able to share your event with others.
Does everybody recall getting Felicia's event listings?
I've only sent one.
Okay, well, you sent one a few weeks ago. And so basically we're trying to not bombard people with emails, but we do want to make sure that the events get out there. Betsy, I don't know what that face is. Is it a face of awe or fright? I don't know what that was. That kind of scared me when it popped up. Or was it a mistake? Okay, so maybe she's not there. Okay, so your event listings. So we don't bombard people with email. We want to get those out. We want to tell people what you're doing, but we need to do it in an organized way so that we're not sending out 2 or 3 emails, or maybe even more. There have been times we've sent out 4 or 5 in one day. So we're compiling them, and she's sending that out the 1st and the 3rd week. So please get those to her. We want to make sure, especially if you're a member of the coalition, we want to get those out. We have more than 200 email addresses on our list. And so it is a good way to tell people what's going on. So if you're a member of the coalition, a paid member, we definitely want to make sure that your event gets out there.
And I think also hopefully by doing it this way, everyone will know then when to expect our email so that you know, okay, it's the 1st week of the month, I should be getting a list of all the events happening so I can be sharing them with my community.
Yes, because I know that y'all are waiting on our emails. You're waiting on the newsletter, the news and events.
Oh yeah, with bells on.
So yes, thank you for that, Felicia. I also want to let you guys know, I've mentioned this a couple of times, that we are also overseeing the vaccine messaging task force. And so we are putting together an event for mid-November with the Boys and Girls Club and Super Shot. And that will that is after the vaccines will be approved for the kids. I think some are already approved for the kids. But I'm not sure if the others will be approved for the kids by then as well. But by mid-November, we will be partnering with those other agencies and hosting that event. And so we hope that you all will join in with us. You'll be hearing a lot more about that. It will be a community event that will be at the Boys and Girls Club. And our numbers in the southern part of the city, southeast part of the city, are still very comparatively low. The last figures that I saw from the Allen County Department of Health were that 46803 was still in the 30 percentiles being vaccinated, while Southwest was 90, I think it was 98%, 95% or something like that, compared to about 30%. I don't know if you read the newspaper. There are still deaths. People are still dying of COVID and getting very sick. So come out and join us once you get some more information about that. There's something, and also Felicia, do you have the flyer about tonight's event with Tobacco Free Allen County?
Yes, let me put it in our chat. So does Pat Turner want to talk a little bit about
I
that?
forgot Pat's on. Yes.
Yeah, Pat Turner can. Thank you for putting it in the chat. Yeah, we are having a community conversation this evening about youth and tobacco use and how the tobacco companies target our young people with very flavored tobacco products and other populations they target as well. And so we would love to have you all join us this evening. It's from 6 to 7:30. It is virtual. We have a panel of individuals who work with youth. We have Dr. Gia Quinta. Nancy and I will be doing a presentation about some numbers and statistics that are local around tobacco use. And so we would love for you to join us. And thank you for putting that in the chat. If you have any questions, give me a call or send me an email.
Thank you, Pat. I have always been very interested to learn more about the targeting that the tobacco industry does
Yeah.
in underserved communities. It is, I mean, once you really start learning, I mean, there's actual
Yeah.
targeted marketing
Oh, yes.
Yeah.
that they don't do
Very,
in other
very-
places.
Yeah, very much so. Yeah.
Yeah.
And they spend billions of dollars a year in doing that. So
Yeah. What other announcements do we have? Joellen. Read Joellen's comment in the chat. It's a little bit long for me to read unless Joellen, you want to summarize verbally?
Yeah, basically, I was just saying that right now our main office in Allen County is closed to walk-ins, but you can make an in-person appointment. I put the appointment line on there. Our phone appointments are also on that line as well. And then our energy assistance program at Bright Point did start. So I put the number that they need to call if they have questions on that, or if they need an application mailed to them, or they can actually submit everything electronically as well now.
Okay, that's great information that we can let our clients know about. Who else has something going on?
Katie has something that she had to hop off the call, but she said that they were hiring for many positions. They're in need of nurses and Burmese interpreters. There's more information on the careers on their website.
Okay, and that would be Neighborhood Health with Katie Murray. Who else has something going on? Maggie.
Pick me.
It's on you. It's your turn.
So we have scheduled a Faith Leaders Forum for January 25th. So this is the first step in us trying to get feedback from faith leaders in our community about what our senior and aging congregations need and how we can be better supporting, especially those who are starting to suffer with dementia or Alzheimer's. So it is an opportunity for us to listen and for us to learn, but it's the first step in us creating a broader action plan. How do we help our aging congregations? So I will make sure to get that invite to Felicia to circulate, but it's going to be pretty exciting. And there's going to be donuts and coffee because it's in the morning. So of course, why not?
And which day is that?
It is going to be January 25th, which is a Tuesday, and it's 9:30 in the morning. We're going to keep it to an hour because we know that our pastors, our faith leaders, our deacons, they've got a lot going on.
And where will it be?
It's going to be at Emmanuel Community Church.
Oh, okay. I saw something about that. Did you send me that already?
Not yet. Hopefully I didn't. I just finalized the flyer yesterday, Sharon.
Okay, so I did. I don't know what I saw. Okay.
But it's pretty exciting. So we're getting pledges from churches to make make more of a focus on senior unity, and we're pretty excited about it. But it's step one.
Okay, and you've been talking about that for a while, so that's great to hear that is now coming to fruition.
Yes.
Who else?
I have an announcement.
Yeah.
Aging and in-home services is part of a statewide initiative. It's called Dementia Friends, and we are providing education sessions about how to build dementia-friendly communities. And we will do that presentation for anyone for free. All you have to do is call and talk to myself or Todd Honeycutt, and we can schedule a meeting or presentation time so that we can help you or your organization become a dementia-friendly community. And it's really awesome presentation, and you walk away having a better understanding of what dementia is and how to serve individuals in your community when they walk in your door with dementia. It talks a little bit about the impact of dementia on families and how it impacts families. And so we are, again, this is a statewide initiative. We were able to do a presentation for IU Medical the other day, and they to their first year doctors. So that was awesome. And so anyone who would like a presentation, is interactive, it's informative, it doesn't cost you anything, and we would be happy to, we're able to do it by Zoom, Teams. I don't know what format we're using here, but different formats, so you can do it online. And it's an hour and 15 minutes, 1 hour and 15 minutes to become a dementia friend. And what we know is that our community is aging, and so probably everyone on the program today has interacted knowingly or unknowingly with someone with dementia. And so it's just a very informative presentation, lighthearted, but a very educational. We also are still doing the chronic disease self-management program. That's a 6-week wellness program. We have we also do diabetes education. It's a 4-week program. And so we are happy to do that for employee programs. If you're in communities, just anywhere they have a group of people, we're happy to come. So if anybody is interested in any of those programs, please let me know. We do a support group online and a guided discussion online every other Wednesday of the month. So caregivers can come, and they can't get out the house, they can join us online to share information. So if you are in touch with a caregiver who is stressed out and looking for community resources, you can refer them to our agency, and we will provide that information to them. Thank you.
Sylvia, so the first program that you were talking about regarding dementia, you said to become a dementia friend. Is that what you said?
Yes.
Oh.
And basically what it is this, it's an educational informative session. It's 1 hour and it's 1 hour and 15 minutes. They have 5 key messages that they want all communities in the state to know and to understand about dementia and its impact on our community. And it's a wonderful, literally it's a wonderful program. And like I said, we were able to provide the presentation to IU medical first year students, and they are already talking about trying to make this part of the curriculum. That's how impactful that message is. And anybody can become a dementia friend. So I invite everybody to sign up. We could do something all at once, sign up, and it's a good hour and 15 minutes. You're gonna walk away with a better understanding. And I think it's a lot of people in our community that don't really know the impact of dementia on our community right now. So it's just a wonderful way to learn. I guarantee you that everyone online today with us has interacted with someone with dementia, and you're thinking, oh my God, this person is so odd, they're so slow, why are they here by themselves or whatever. And this gives you some really good information and a better understanding of dementia and Alzheimer's
Yes,
and
it
how
sounds
it's
interesting.
impacting families.
Yes, thank you so much. Yes, we appreciate that. Thank you. Anyone else? Felicia, did you see that Autumn put her email address in the chat there? She wants to be added. Yes, great.
Yes, I already took it down and I sent her a message.
All right. Okay. So anyone else? Okay, Autumn is saying something long. I can't read all that quick now. Autumn, come on and summarize that.
Okay.
Is she not going to summarize it? Peggy, read Autumn.
Oh,
oh, wait a minute. Here she is. Here she is.
That's a book.
It's not. I was just saying that as we're all working with these underserved communities, I just want you all to keep Aspen in mind. If someone mentions that they don't have health coverage, I would love to assist them in applying for Medicaid or Marketplace or just seeing what they're eligible for. And I said that 46803, 06, 07, 16, those areas have really large numbers of uninsured individuals. So just keep that in mind as you're working with people. I'll take any and all referrals. I'd love to meet you guys in person. We can talk some more about Aspen. I can bring some flyers or whatever it takes. But my contact information is there in the chat as well.
Sounds good. Thank you for that reminder. Good. Okay, peeps. Anything else? Dr. Johnson, you don't have anything awesome to say? You haven't been here in a while. You're on mute though.
You're mute.
Muted.
Good morning. I don't have anything awesome to say, but I will say that I'm starting a podcast on health disparities that affect the general population, but the target population are Black women. Mm-hmm. And I'll be starting that podcast, I believe it's going to be December. As you can see, it's called On This Heartbeat. So I have my logo on the back of me. But I welcome any type of narratives of people that you know that have experienced health issues and also that have experienced systemic bias, implicit bias in the healthcare industry, that they believe that they've experienced that. So that will be welcomed. I'm looking to do interviews with a lot of people, hopefully with professionals, lay people, and just getting the word out there that health disparities exist. I'm looking at wellness issues with the target populations, but I'm also looking at ways to solve the health disparities, in particular related to cardiovascular disease that Black women experience. So I'm open to all of it. So I welcome everybody's feedback. And I'll send the link hopefully by the next meeting or two, I'll be able to send the link to the podcast to you all.
See, you didn't realize, but that actually is quite awesome because we've been considering doing some programming for especially that, focuses on some of the disproportionate amount of stress that women, in particular Black women, face. And I just realized you could help us.
That's fine. I'll be glad to. I look forward to that.
Okay. All right. Anything else? I see somebody else has put something in the chat. Okay.
Be careful what you volunteer for.
What?
So be careful what you volunteer for, Dr. Johnson.
Oh, what, Peggy? That wasn't
all right.
No, because we will use you.
Okay.
That's fine. And I did send you guys, hopefully you'll get it today, my new email address. So that way I know I can get your messages more, in a timely manner, because I did switch email addresses. So.
Oh, okay. And you sent it to us. Great.
Yep.
Okay. So happy Halloween, Maggie says to everyone. Yes, be safe. Look, guys, if nobody has anything else, am I missing anything? Felicia, Peggy.
You gonna tell them about your thing at 12 o'clock today?
I thought about that, but they never sent me a flyer or anything. Okay, so I'm going to be on a panel. And I'm going to be on a panel with Ivy Tech at noon, from noon to 1. And the topic sounds very interesting. It is called something. It's called vaccines, political or something else. Political or not?
I think it's political or cultural.
There you go. Political or cultural. So there are a lot of important people that are going to be on there. And so I will be a very small fish. But you got Dr. Sutter's going to be on there, Matthew Sutter from the Allen County Department of Health. There's someone from Lutheran who's going to be on. There are other names of big time people that are going to be on there. And we're all going to be talking about political or cultural issues concerning the vaccines. I don't know a link to tell y'all to get on.
It's in that. Trisha, we have that link that we did on Monday. She put that on there.
Oh, is it on there?
I think that's
yes.
right. I
So
can
can
look
you
and
put that in
put
the
in
chat?
Oh, you have
Yes,
the
you
flyer,
did.
Felicia?
Huh? No, you gave us the link.
Okay. I don't know what they're talking about because I'm older and confused, but I know I have my link as a panelist, which is different from your link. The link that I have as a panelist in the webinar is different from any public link. So I'm not sure what the link would be, but if y'all hear about this, sign on. And if Felicia can find a public link, sign on, and it's from 12 to 1:30.
Okay, I believe I found the correct link, so I will put it in the chat. It's a public one.
Isn't she awesome? So there it is, if you want to do that. Okay. Anything else? If there's nothing else, I'm gonna give y'all 3 minutes back. Or actually longer, because we usually go a little bit longer. Okay. Bye. Have a wonderful day and a wonderful weekend.
Toodles.
See you later.
Happy Halloween, everybody. Bye-bye.
Bye. Bye, Beezy.